Good afternoon, ADN class and Professor Marsh. I'm Colton Caskey, and I'm going to be presenting my health promotion project this afternoon. The topic I received is pneumonia, so if you don't care to just follow me along the PowerPoint, and we will go ahead and get started. So move to slide 2 with me. We have to ask ourselves, what is pneumonia? Pneumonia is an infection that affects one or both lungs. As you can see in the photograph below the text, the lung set on the left is a normal lung. You can see there's nothing really to look at. The lungs are just black, and that's because they're filled with air. They're healthy, and air is invisible. However, the lung set on the right, there's that very large white ball in the patient's right lung. That is the fluid, the infection that is just clogged in that lung. It'll show up as a big white ball, a big obstruction. Move to slide 3 with me, and we'll speak of what actually pneumonia does to the body. So the little air sacs in your lungs are called alveoli. Those alveoli are what exchange carbon dioxide and oxygen with the blood. It's the main site of diffusion and subsequently perfusion. So when this infection, this pus and this fluid fills the lungs, it becomes very difficult for the body to diffuse and perfuse oxygen. That's why pneumonia is such a serious disease to have. Moving forward with slide 4, let's discuss the manifestations of pneumonia. A patient might suffer a cough that produces a greenish, yellowish sputum, even sometimes bloody mucus, a fever, sweats, shaking, chills. Patient might see shortness of breath, rapid and shallow breaths, a sharp stabbing pain in their chest that progressively gets worse if the patient coughs or breathes deeply. Loss of appetite's common, fatigue, low energy, nausea and vomiting in children, very common cause or side effect in children. Confusion in older people, that's a very common symptom in the elderly, so it's definitely something to be aware of with those two age groups. Moving to slide 5, let's talk about the diagnostics and the tests that you can do for pneumonia. So the most common is a chest x-ray. As you remember in slide 2, that visual aid at the bottom below the text, that was a chest x-ray, left patients being a normal, healthy person's lungs, the one on the right, one infected with pneumonia. That is the most common way. Now, a sputum test is a common thing you would do to a patient that has pneumonia, and that's so you can narrow down the bacteria that is affecting the body, the specific one, so the provider knows the correct antibiotic to prescribe to the patient to effectively treat pneumonia. We'll get into in a moment why it's so important to effectively treat pneumonia. Some other things you can do is a pulse oximetry to see how the blood O2 sat is. It could raise this. Obviously, it will be decreased if you are infected with pneumonia. Your ABGs, blood test, pleural fluid culture, and even bronchoscopy are ways that you can check for pneumonia. Moving into slide 6, let's discuss the complications of this disease. Now, unfortunately, pneumonia, if treated improperly or not treated at all, it can result in very drastic diseases that you do not want to come down with. So we'll go over ARDS. It's commonly known as ARDS, acute respiratory distress syndrome. This is a severe form of respiratory failure that you do not want to experience. You want to avoid this at all costs. Another thing that pneumonia can sadly form are lung abscesses. Now, an abscess, that's a pocket of pus, essentially. They can form on the inside or even around the lung. It's not something that a patient wants to deal with. It will cause for surgical removal, usually. Total respiratory failure. This is going to require putting your patient on a breathing machine or a vent. Absolutely something that we want to avoid. It is never something that we want to do, is to put a patient on the vent. So that's why proper treatment is necessary. Finally, sepsis. Now, as you can see, I've provided a visual aid at the bottom. Sepsis kills 270,000 Americans annually. It's a medical emergency. It's something you absolutely do not want your patient to go through. Some signs of sepsis, fever, cold, shivering, pale and mottled skin. The patient will experience pain and discomfort, rapid breathing, an elevated heart rate, and even though they will be disoriented and confused, sometimes almost as if they're trying to sleepwalk. So this is something that you absolutely want to avoid, and that's why it's so important to treat pneumonia properly. Now, if you'll move to slide 7 with me, we'll discuss how we can treat pneumonia properly and discuss the human flourishing aspect of it, to where we can prevent pneumonia, proper treatment, and for patients who are recovering from pneumonia, how we can improve their life as well. Now, I have a quote from Gil Wayne that runs Simple Nursing. It's a wonderful website that is great for studying for student nurses. So on the topic of pneumonia, Gil says, treatment for pneumonia can include antibiotics, antivirals, antifungals, over-the-counter meds to help with the fever that comes with the illness. It is very beneficial to drink plenty of fluids and eat heart-healthy foods while sick with pneumonia. Avoid the use of alcohol, illicit drugs, and tobacco while sick with pneumonia. Also, avoid secondhand smoke. It is just as important. Get plenty of sleep and participate in mild exercise. So those are ways that you can treat pneumonia. Now, let's go into the human flourishing aspect of pneumonia. As a nurse, it's important to promote human flourishing, to make the patient feel comfortable. Pneumonia causes extreme discomfort. So some things we can do is we can educate the patient on proper coughing, deep breathing, and incentive spirometry use. That is a wonderful way to accommodate the treatment of the pharmacological treatment of pneumonia. Manual interventions. An elderly patient that's too weak to cough up those secretions, we can manually suction them out. As far as promoting the prevention of pneumonia, the number one thing we must instill in our patients is smoking cessation. Smoking is the leading attributing factor to pneumonia for the elderly and the middle-aged that come down with the disease. So it's very important that we instill in them to not smoke. It is so important. Again, as seen from the previous slide of everything that pneumonia can develop into, it is very important that we manage and treat this disease properly and prevent it at all costs to promote our community's well-being, our patients' well-being. So we've arrived to the end. You can see my reference page, number 8, if any of you would like to fact check me or explore these websites and gather more information. They were very well put together. I have myself put together a practice quiz for you. It's just a way to sort of drill the information in. I really do think it's going to help. And you all have the PowerPoint, so if you do not achieve an 80%, which would be a 4 out of 5 or higher the first time, I want you to retake it until you remember this base information. So let's move over to slide 10, and we'll look at the first question. So question 1, what is pneumonia? I'm going to give you a few seconds to come up with your answer. All right, guys. Let's move on. Let's look at the answer. Pneumonia is an infection that affects one or both lungs. Remember, it doesn't have to be both. It doesn't have to be just one. It can be one or the other. Moving on to question 2. What are the causes of pneumonia? All right. The answer is it is derived from a bacterial, a viral, or even a fungal infection. Let's move over to question 3. What part of the lungs are affected by pneumonia? All right, guys, the answer to that is the alveoli, also known as the air sacs of the lungs. That is what is infected, that is what is affected by pneumonia. Let's move over to question 4. A true or false question. Blood culture is the most common way to diagnose pneumonia. All right, guys, it's actually going to be false. Obtaining a chest x-ray is the most common way to diagnose pneumonia. Moving over to question 5, I wanted to throw an NCLEX style question in here just to prepare you guys for your NCLEX. A patient is diagnosed with pneumonia. He's being discharged, and he tells you, I dang well don't want to take a break from my Marlboro Reds and my Coors Light until I'm better, but I know I have to. It's going to be okay if the wife smokes around me, though, I reckon, ain't it? How would you respond to this patient? I want you to formulate your own response, and If it's along the lines of the response given, then I want you to count it correct for yourself, as long as you have a basic understanding. All right, guys, so your answer should follow along the lines of, actually, secondhand smoke is just as dangerous for you. It is important to avoid all types of smoke during the recovery process. And guys, I included a grading rubric after this slide just to help you out to see where you're standing. I really do think that if you can understand this base amount of information, it is a solid basis foundation for understanding pneumonia. I did want to thank you guys for your time today, and I do very well appreciate it. Hope you all have a wonderful day.